presenter name and presenter photo. You can also give some brief description of the site. The next slide you should use to describe the sustainable policy and system change that you're working toward. It could be in one focus area, and what you could do is it could be in one focus area, or it could be in two focus areas. So it could be about healthy eating, active living, or it could be about social and emotional health. It could be about school employee wellness, but you don't have to do all of them. So this schema is based on proposing, just talking about one of the things you're working towards, one policy and system change, and following that through in slides 4 through 7, 8 through 9, 10 through 11, and 12. So we'll have a little bit a greater of a sense of what you're doing in one area as opposed to multiple areas. So slides 4 to 7 would be development of strategies to address this situation. Again, what approaches are you taking? Analysis and evaluation of the intervention. That's the data piece in slide 8 and 9. And 10 and 11 would be lessons learned, and 12 will be links to resources and the contact information. An alternate to this would be to use the first 5 or 6 slides to tell about one intended policy change, and then to use a second set, slides 7 through 12, to tell about another intended policy change and your efforts towards that. But don't feel pressured to talk about every single activity that you're doing or even all of policy change work. If you can tell 1 or 2 strong, compelling stories about how your work will contribute to the big picture of changing the norm of health and wellness for students, I'd personally consider it a win. Okay. We take a little break, take your arms and reach them up, like the sky, like you're a tree, and oh yeah, that's good, like out like you're a rainbow, so spread them, you know, left and right, and back up to tree, down to rainbow. We're all sitting here, it's very silly to watch, but I feel a little bit better already. Okay, so thanks again for all the listening. I know it's a lot. So what I did is I created an example storyboard, and I'm basing it off of Milwaukie High School. So Rachel and Christine, feel free to jump in at any point in time to add a little bit more about each of these different components. But all of this is, I went to Milwaukee's third quarter report, and I looked at the beginning of the report where it asks about healthy eating, active living, and I saw what work they were doing at the systems level, and then I built this based on that, and then I went to what they're doing at the clinical and primary care levels, primary prevention levels, to be able to fill out the storyboard a little bit more. So the storyboards, especially set up like this, are meant to tell a clear story. Makes sense. That's the term, right? So, so the systems change that you're talking about is going to be on slide 3, and then 4 through 7 are going to talk about the individual day-to-day clinic work and primary prevention work that you're doing that supports the system and policy change that you're working toward. So let's walk through it and see how it flows. So on 1 and 2, Milwaukie High School would introduce themselves. So Rachel would introduce herself and Christine would introduce herself. And it would provide some brief background on the school, on the school population, etc. Then on slide 3, they would talk about what they're trying to do in the area of healthy eating, active living. So their overall goal is to decrease prevalence of hunger by the next assessment date. And Milwaukie used the Oregon Healthy Teens as the school assessment that they were that they're planning to compare data from 2015 to when it's given again. I think it's next year, correct? It's either 2017 or 2018. So based on that, the policies that Milwaukie indicated that they're working towards are creating a district-level food insecurity policy, implementing food insecurity screenings for all the school-based health centers district-wide, creating and implementing coordinated referral process for students who have been positively identified as experiencing food insecurity, and identifying leaders and providers, teachers, students, and counselors to serve on a task force. So again, big overall goals with regard to food insecurity, and here we have a policy that's going to be implemented. We're going to have a task force or a team that's going to be a part of that process to get that policy approved. And we also hear about a coordinated referral process, which would also be a part of the overall district policy. So quite ambitious, but we're looking forward to seeing where that goes. And it sounds like you guys are making wonderful progress towards that. And to that end, we hear about, so slides 4 to 7, if you'll remember. 4 to 7 are document the approaches that you're taking or the strategies you're taking to address the situation. So in the clinic, Milwaukee's screening for food insecurity at their school-based health center. They're screening all of the new patients, and they would maybe tell a little bit more about how they came up with that screening, who's doing it, who's getting screened, how we know they're getting screened, and what happens with that screening result. And then you hear a little bit more about that, where once a student is screened and they're positive, they're connected, the school-based health center connects them to either a food justice cooking class or a horticulture club, both of which the school-based health center has been involved in creating, and they would provide additional explanation of what those things are. And of course, although we have a lot of words on this slide, we encourage you to use photos, use testimonials, use quotes, etc., to be able to highlight those things. So again, I apologize that this has so much writing on it, but it's really to just kind of show you an outline of what you could do with your storyboard. So we talked about how in the beginning, Milwaukie talked about decreasing the prevalence of hunger as an overall goal, and then creating district-level food insecurity policy. This is what they're doing to get to that place. So we heard about what they're doing in the clinic, and at the primary prevention level, they were increasing school-wide food literacy. So they're having their youth advisory committee create promotional materials for a harvest share and making classroom announcements, and then doing school-wide demonstrations on smoothies. So you'll see, it's not just talking about the smoothies, making the smoothies themselves. It's talking about making the smoothies in the context of this is a school-wide activity that is about health and healthy eating, and it fits into the schema of the policy that they are trying to change. And a good question was just asked about not needing to do top 3 accomplishments, just doing one. Yes, you guys can focus on one system or policy change, and I'll make a modification of that in the storyboard parameters. So yes, you can focus on one system or policy change, just like we are. Okay. So you see how all of these are in the context of that policy change. And you could talk about demonstrating how doing smoothie demonstrations contributes to reducing hunger, because students are learning how to increase fruit and vegetable consumption in a way that's unconventional, etc. Any questions about that? Rachel, am I capturing things, or Rachel or Christine, am I capturing your storyboard essentially how you would like it to be, or would you put things in different spots? How about anyone else? Do you guys think that this flow makes sense?
This is Lori. I think it's great to have this example. I think it's really helpful because it makes it concrete and really illustrates well the focus on policy level work. And from my take on the Milwaukie work, I think this really shows it well. Great.
Okay. All right. So moving forward just to the end of what Milwaukee's storyboard presentation might be. 8 and 9 were about analysis and evaluation, so they could present some data on hunger from the Oregon Healthy Teens. They could provide data on their alternate breakfast participation, which they talked a little bit about in their storyboard from the endpoint meeting from last year. They could talk about the number and result of food screenings and food insecurity screenings to date, which I know that data is still being analyzed. I could also talk about the change in participation in the harvest share as a result of some of those outreach and awareness efforts by the Youth Advisory Committee. And if there is data at that point in time, the outcomes of the food justice cooking. Those are options. Those aren't things that you don't need to overwhelm the crowd with data. Pick the data that's most important to highlight the impact of your work, most salient. And we'll be utilizing these storyboards as a springboard for our conversations at our regional meetings in the fall, with hopefully some additional funders and other stakeholders. So a solid foundation now will mean not much work will have to be done for the storyboards to present them to the regional meetings and the other key stakeholders there. So just going back to Milwaukie, 10 and 11 are about lessons learned. So I know that Christine and Rachel had identified some lessons learned in their quarterly report. And one of the things that you guys could do in your lessons learned are some of the barriers that you have identified and some of the approaches that you have. And then slide 12 should be a link to some either resources that you have or that you will be providing eventually, and just some of your contact information. So one of the things that Christine and Rachel might provide, which they've already provided to us on Basecamp, is an example of the food insecurity screening tool and the coding for it. They might include something like a description of the task force, the food insecurity task force. They may include something they're working on, a summer food resource pamphlet, or they may include the final referral or workflow or policy that's created as a result of bringing this tool to the school board and talking about its impact. So that is a pretty full example. Of course, I'm here, as well as your state affiliates are here, to be able to help you think about telling your story in this type of clear and concise manner. So feel free to reach out to us. Okay. But I'm glad this example is helpful, and thank you, Rachel, for letting us utilize your site as the example. So by the end of the year and by the end of the project, school-based health centers should be able to clearly state the policies, protocols, and system changes that you're working towards and that you have been able to create. One key element of sustainability is to have written documentation of these policy changes so that everyone who touches the school-based health center is aware of them and they don't just live in your head. So again, at the end of the year and at the end of the project, we'll be asking, for these to be codified through write-ups and templates so that we can begin to share the lessons learned from Hallways to Health with a broader school-based health center field. So that being said, I know there's been a lot of conversation about policy change and system change. So what does count as a policy or system change? Things like school and district level policies, system changes may be nutrition guidelines for school lunches, or activity guidelines, or recommendations that grades K through 6 must have PE a certain number of times a week, and that may be different than the state level policy or the federal level policy. Another school level policy could be, or district level policy could be documenting the provision of student support services. But other things that you guys could be working on through Hallways to Health that may not necessarily be at the district level are MOUs and LOAs, so Memorandum of Understanding, Letters of Agreement. Do you have them with the school? How about with the district? What about with your community partners? How about with other student support services? What about with parent groups? Providing any of these would be a great example of a policy or system change that your Hallways to Health site has worked on. What about job descriptions? I know that many of you have school liaisons, whether that's a principal or a vice principal, whether it's a teacher liaison, whether it's just a job description for you as a health educator and your role in the school. So that also counts as a policy or system change. So let's say you have a school liaison, but you don't think it's a policy change. What would make it a policy change? Writing it into their job description that they're, one of their commitments is meeting with the school-based health center on X, Y, and Z basis to coordinate student services and student support. What about new protocols? Let's say Milwaukie was talking about a referral process for food insecurity. So if they write up a new referral protocol, that's included. What about handoffs between your primary care provider and your mental health provider? What about follow-ups? How's care being followed up? What's the follow-up by the teachers, by the parents? If you have a procedure for any of these things, these would all be counted as policy and system change. Care coordination, how you're coordinating care with your social workers in your school, with school psychologists, with other community groups that are that you're working with. What about your consent process? Do you have one? Do you have a protocol for collecting data or for sharing data information with within the school or to parents or to the health department, whatnot? Do you have a protocol for screening? Do you have a protocol for your commitment on to wellness, like through professional development or in the classroom? So if your principal says, yeah, school-based health center, you can deliver a professional development session once a year at the beginning of the school year during our teacher orientation on school employee wellness, that can be codified into a protocol. Do you have a protocol for school-based health center outreach and enrollment? Any of these would be counted as policy or system change. Also, if you have new structures or teams which have been created through Hallways to Health, so many of you have cost meetings that you participate in, advisory meetings, wellness teams, improvement teams, school-based health center meetings with other area school-based health centers. Any of these can be written up as a policy or system change. So we're not looking for you guys to, although it would be wonderful to change the state policy on minutes of physical activity per day, but we're looking for you to document and codify what you are working on, which really is changing the system and the culture of health at the school. What about if you have created a new curriculum or introduced a new curriculum? So I know that Hope Clinic is working on getting a social emotional curriculum introduced into their kindergarten classroom. So that would be an example. If that curriculum is written up, that would be an example of a policy or system change. Right here we have examples from 2 of our sites. It's a little bit hard to read because it's a little bit small, but actually on the bottom, this is an example of Merlot Station and Christina's wonderful tracking document for health education. So you'll see she tracks the number and reach of interaction with external partners, parents, students, school staff, feeder schools, electronic communication. So she tracks the number of group presentations, the number of materials distributed. So, you know, this is a great tracking tool. And then on the right, there is a workflow from Milwaukie High School, again, about mental health, and it talks about their referral and follow-up protocol. Okay, so those are all examples of policy and system change. I will be posting the slides on the website after the call, and so you can see all of those. And I encourage all of you guys to share any documents you have like this, not only on Basecamp, but to bring them on a jump drive to our meeting, to our Hallways to Health meeting as well. Here's another example. Rice Elementary School is located in Chula Vista. This is their district wellness policy. So you can see they have line items on physical activity, on food. So these are things that we would love you to share with each other and love you to share with us. Okay, and last but not least, we have some examples from Lake Forest Elementary. An example of their school-based health center referral form. You could see not only, I cut off the beginning of the referral form, but it talks about what happened to the student after they came to the clinic. So that's real data that gets put into the system, and then at the end of the month or quarter, Kathleen can look up how many people have returned to class or been sent home or sent to another place after a visit at the school-based health center. And on the right, you actually see their workflow about how they refer and what they do as well. So all of those examples that were from you guys were all examples of policy and system change. So ask your state affiliates, ask me, is this a policy change? Is this a system change? Most likely it is. It just needs to be framed the right way. Okay. This is a lot of talking by me. You guys still there? Everyone give a little hi.
Hi, we're here.
Okay.
So you wouldn't be bothered by us making comments and forth about what we're going to do.
No, not at all. I appreciate it, though. I know it's a lot of listening and a lot of me talking, which is probably too much. I just wanted to make sure you guys had all this information. So
yeah, we're going to be. I can never figure out. Probably Allison can figure out how to access these slides later, so we can go back and. Allison can figure it out, right? Can you figure it out, Allison?
Yeah.
Okay, never mind. Okay, I'm going to put it back on mute.
Great, thanks, guys. I'll make sure to share the slides and the recording as well. I know that the recording is hard, but if you know what slide you're looking at, you can scroll to the place in the audio so you can hear one specific section. For instance, if you want examples of the policies and a little bit more detail on that. Okay, so we talked about the storyboard preparation. We'll be having a session on the action plans, so be sure to review your action plans as a team and make sure they're updated with your current thinking prior to the midpoint meeting, and bring 3 to 4 copies each, and if that's a problem, you can let me know. Also, we are encouraging you, as I said, to bring your toolkits, your policies, your templates. You can bring them on a jump drive. and we'll have prizes for those of you who have things to share. And just reflecting back, we'll be having a conversation about the data that you can collect at your school-based health center to talk about your impact and the value of your work. So just, you know, with your teams, have a conversation about the types of data that you do currently collect and that would be possible for you to collect and that would be beneficial for you to collect or for you to be able to share with your medical sponsor agency, your parents, your community, etc. And next is we're going to be brainstorming a little bit for the regional meetings in the fall, which are going to be about sustainability. So one of the things that we're going to do is come up with an invitation list for the fall. So bring any contact list for your sponsor organization, list of your partner organizations, so you can have that right in front of you when we're thinking about who we should be including and why we should be including them. Okay? Bring business cards, not only for our hallways meeting, but for the rest of the convention. It'll be a great opportunity to network, etc. And last but not least, Natasha is going to tell us a little bit about, she planned a lovely optional dinner outing for us, but highly encouraged. So Nataki, if you want to tell us a little bit about it.
Sure. So there'll be a dinner reception at the Portofino restaurant in Crystal City. It's right around the corner from the hotel, just about an 8-minute walk, and it will be at 7:30 p.m. Dinner, it includes an appetizer, salad, an entree, dessert, and coffee or tea. Or you can choose to have the dessert or appetizer optional, and the prices will be different. I think you guys have gotten an email from me, so the price will be $40.95 per person. And of course, please bring your wallets for this dinner as well, and there's different menu options available for you guys too. And if you want to tag along with me and Jordana when we walk to the restaurant, you're more than welcome to do it. So just let us know, catch us before we go. We'll wait a little bit in the lobby for everyone. So yeah, we're hoping to see you guys there.
Great. Thank you so much, Nataki. I'm looking forward to, obviously we'll have a full day ahead of us at the convention, but I think it would be a lovely opportunity for us to have some non-specific talking about hallways to health time. Always over a good Italian dinner is always something to look forward to. So thank you so much. Can we get a sense, actually just in the chat box, and you guys can write down yes, maybe no, no interest, yes, I'm in, etc. No need to formally RSVP. Okay, great. We're starting to get some folks saying you guys are in, so awesome.
And one person just asked if your family is allowed. Yes, your family is allowed. We'll just ask them to increase the seating, but this is unsponsored.
Yeah.
So yes, your family is always allowed.
Perfect. Great. Okay. Lovely. Looking forward to it. Okay, great. So just moving forward, I know we are, we'll try to go a little bit early here, but just wanted to provide some quick project updates. Midpoint meeting, have you guys heard about that? Yes. I've just been talking about it for 56 minutes, it looks like. So looking forward to seeing you on June 26th. I wanted to tell you a little bit, Nataki's going to tell you a little bit about the photo contest. She sent you an email today, but she'll fill in a little bit more information for you.
Okay, so we're in the process of revamping our Hallways to Health website. Yay, yay! Woo! And we would like to feature some of our SBHCs on the webpage so that people can get a feel of who is helping the schools and the type of work they're doing, get a visual. So basically there's a photo contest, and the person who, or the site who submits the best photo, something that showcases your work or your staff or anything that really speaks to what your site is doing at the time or moment, will win a $25 Amazon gift card. So I know that everyone will be excited to compete for that. So if you can just submit your photos by June 22nd to my email address, and I sent it out in an email and on Basecamp too, but I'll send it out again if you need it. And just submit at least one photo, just to showcase, you know, your SBHC pride. So please do.
Yeah, thanks, Nataki. It's a great way to spruce up our webpage, and I'm sure you'll be thinking about some great photos as you're creating your storyboards. Again, please don't be like, do as I say, not as I do. Please include a lot of photos and not nearly as many words as I did on these slides, unless it's you know, really necessary. So we will be, as you know, at the end of the year, so we will be sending out the template for your fourth quarterly report following today's call. Probably it'll be tomorrow morning. But please return your report to your state by the date they determine, and those will be due to us from the states by July 15th. And invoices will be processed after the quarterly reports have been submitted and reviewed. And the templates for the invoices are on Basecamp. So this report is going to be pretty similar to the last report, asking you about your progress, etc. But it will also include some reflections from our Phase 2, Year 1. It'll also include questions about scheduling our learning calls for the next academic year. So I know that I want to be mindful of the times that are best for you in your clinic and in your day, and around your other standing meetings to be able to have maximum participation and engagement. And it also includes this chart, which you can see at the bottom of the page, which talks about the efforts that you put in and the measured outcomes. So again, you might summarize, in the clinic for healthy eating, we are screening new patients for food insecurity, and the measured outcomes might be the number of, you know, we have screened 250 people from January to June. 50% of those that we have screened have been positive for food insecurity, etc. And you might do the same thing for system change and primary prevention. So this is just asking you to think about not only this last quarter, but the entire year. Okay, and those reports will be used to modify and reflect and change some of the things that we're doing for next year, and to schedule the learning collaboratives for next year. So we will not be having a call in July, but we will be regrouping with a date to be announced for an August call. So I know that many of you are going to be doing super fun things and going on vacation, and some of you might be at the school-based health centers running summer programs for incoming freshmen or summer visioning retreats. But we'll give you a break for July, and we'll reconvene in August, because we have a big meeting at the end of June as well. So. And then our regional meetings will be in the fall, and everyone has those dates, and I will send them out again just in case. Anyone have any questions? No? Okay. So, I mean, summer is a great opportunity to eat healthy and be active. We just wanted to provide some motivation for you and your students. So the picture on the left said, "What's your excuse?" with that kangaroo in 2011, and he's like pretty jacked in 2013. And the other one says Mondays here, time to eat clean again. So you can use that for summer kind of as well. Okay, great. And that's it from us. So we will see you soon in Washington, D.C. And we'll be sending out an email tomorrow with, again, all the information on dinner, the photo contest, the revised storyboard parameters, and a link to the slides and recording. So look forward to, as well as the quarterly report. Okay. Anything else?
Thank you, Jordana.
Thanks, guys.
Bye.
Thanks.
See you. Thank you.
Bye. Thank you.
Thank you. Have a good day. Bye.